My name is Dr. Chaya Lieba Kobernick, and I'm so excited to be offering this panel slash webinar tonight slash today for everybody in the States. And our goal for today is to give some information and answer some questions and have some real dialogue about building a meaningful, sustainable career as a psychologist in Israel. You're going to hear different paths, different experiences. There's no one right way, clearly. And hopefully, you're also going to get answers to your questions, as varied as they may be. Thank you for sending in any questions that were pre submitted. I am grateful. Yes, this is being recorded, and anybody who registered will get the recording. So if you can't stay for the entirety, you're welcome to send in questions, and I'm going to be trying to get to as many of them as I can. Um, um, I'll start with an introduction for myself, and then all the panelists will introduce themselves. Like I said, my name is Chaya Lieba Kobernick. I'm a clinical psychologist. I'm also founder and director at the CBT DBT Center, which is a group practice specializing in evidence-based mental health care for the Orthodox Jewish community. We have offices in Jerusalem and in New York and New Jersey, and we have therapists in both locations. I made Aliyah 5.5 years ago with a growing private practice at the time, and that evolved for me into what I do today. And I'm happy to answer more questions about that when we get to the live Q&A at the end. And now I will hand it over to our panelists to introduce themselves. If each person can answer, who are you? What's your current work setup? And what surprised you most about working in Israel?
Okay. Hi, everybody. My name is Allison Spicer. I'm the Associate Director of the International Medical Aliyah Program at Nefesh B'Nefesh. We give guidance on the bureaucracy process, where to start, things to consider. We're happy to put you in touch with other psychologists who've been there, done that. We work very closely with Abigail and Yechiel from the Ministry of Health. And I'm not a psychologist, but I'm happy to answer your general questions about working as a psychologist in Israel, but more importantly, making sure that you're talking to the right people, understanding when you should be starting the process, etc. Thank you very much to Chaya for putting this together. I'm very excited to be joining you for this webinar.
Hi, everyone. My name is Batya Bronstein. It's a pleasure to meet you all through the screen. I am a clinical and school psychologist. I work in Beit Shemesh. Did my training in the US, in New York. Have a PsyD in child clinical school psychology. And here in Israel, have mumchiyat in both areas. We call them tchumim. In terms of my current work setup, I spent time working in the public sector for 6.5 years and currently work mostly in private practice and at Tel Aviv University as well. And what surprises me most, I think, has shifted over the years. Initially, just the differences in some of the training and practices. Now that I've acclimated, I think what surprises me is that I'm able to work in Hebrew and I feel comfortable working in Hebrew, and I'm very glad to be at that point.
Okay, so I'll start. Hi, I'm Avigal Dagan. I'm a chief psychologist in the Ministry of Health in Israel, and I'm a clinical psychologist. I've been working all my professional life in public service. I also have a private practice, but for the last few years, or more than a few years, I've been working in the Ministry of Health and dealing with registration and internship and specialization and more things, but also that. Me and Yechiel work together, and Yechiel will speak about the process of becoming a psychologist in Israel and a clinical or any professional psychologist in Israel. I'm really happy to be here. I'm happy you invited us. I'm happy to share information. We're happy to help always. You're all invited to write to us. We always answer. We try to answer fast, but we always answer. I think, as Batya said, one of the big challenges for people coming to Israel is the language. And in our profession, language is the profession, or the profession is the language, both ways. So it's even more of a challenge. But this is apart from the whole process of becoming a psychologist in Israel. So that's for now, and we'll probably be speaking later. Yechiel, why don't
I can speak. Hi, I'm Judith Levin.
So maybe I'll continue. What? So I'll continue. My name is Yechiel Asulin. I'm at what?
Go for it.
I heard some comments. Okay, my name is Yechiel Asulin. I'm a clinical psychologist, and I'm working also in a private practice and also part-time in the Ministry of Health as the director of licensing for psychologists who trained abroad or international graduates, including Olim Chadashim or Israelis who choose to learn overseas. I agree everything Avigal said, and I'm open to hear your questions.
Okay, hi. Hi, Yechiel. I think we met before.
Hi. Yes.
So yeah, I'm Judith Levin. I made Aliyah about 10 years ago from Baltimore, and we're living, thank God, in Ramat Beit Shemesh. My training is also in clinical psychology. I went to Furkov, and thank God, I've really been very gratified at the way that my professional life has looked like in Israel. I'm working for the past 8 years as a psychologit mumchit in Kfar Shaul Hospital, primarily in the psychogeriatric unit, and then I also supervise interns and students in other departments. And I also have a private practice where these days mainly I'm also a provider, what they call a sapakit for Misrad HaBitachon. I see a lot of soldiers or previous soldiers and miluimnikim with, unfortunately, with post-trauma and other, in addition to other adult therapy patients.
Hi, everyone. My name is Melissa Mandelbaum. I am a clinical psychologist in my training. I got my PsyD from LIU Post and made Aliyah in August, so I'm still new here. And I have a private practice. So currently I have my American private practice and I see patients virtually through there. And I also have an Israeli private practice. So I have my mumchiyut in clinical psychology and I work both remotely, but predominantly with my Israeli patients. I work in person in Yerushalayim and in Ramat Beit Shemesh. I live in Ramat Beit Shemesh. What was I most surprised about? I think, and I'm still kind of figuring things out here in the field. And I think something that I've been trying to navigate and that's been different than it was in America and that I have been surprised about is the process for very young children and families to seek out psychological help. And I do work with many young families in America, so it's been interesting to see how that process can be quite different here in Israel.
Hi, my name is Mordechai Goffman. I'm a clinical psychologist. I'm the senior psychologist in the trauma unit in Sha'ar Tzedek Hospital and work in private practice. All my education and training were done in Israel, so I don't have that frame of reference of what surprises me here, but I'm happy to answer questions about working here.
Hi. Last but not least, my name is Neil Bauer. I'm a licensed psychologist in New York and actually several other states in the US. I made Aliyah about 5.5 years ago, and prior to that, I also received my PsyD from LIU Post. So same with Melissa and Chaya Lieba. And my currently I work mostly about like 99% remote. Few sort of in person here and there, but mostly remote. I work in a group practice in the States, as well as I also teach at Bar Ilan in their gap year program called Israel XP, and I teach Intro to Psych there. I think what surprised me the most was, in terms of working remotely, the most surprising thing was just how much of a challenge it is to work those nighttime hours and balance with family. I will say that it is doable, but it's been a challenge that I think one thing when you're working in the States you sort of maybe take for granted sometimes. So
Amazing. Thank you, everybody, for introductions. We are going to hear now from, I believe, Yechiel, giving us an overview of the process of getting licensed as a psychologist in Israel. Take it away.
Yechiel, you're muted.
A little bit more time than usual somehow. Uh, am I? Um, can you co-host me or something like that?
It's a different setup on webinar.
What?
You should be able to share it yourself.
Okay. To share screen?
Yeah,
Okay. Yes. I see that. Okay.
great.
Um. Okay. So I'll do that. Somehow I can't.
Is there a way for you to like request it and then I can click?
Vigal, maybe
I'll
maybe
try.
you can
Just a sec.
share the.
Just a sec. I'll try.
I have a message. Host disabled attendee screen sharing
But you're not an attendee, you're up
somehow.
on the list. You should be able to. Here, make co-host. Try that. And try now.
I have that.
Okay.
I have that too. Do you want me to?
So a short. Is it on? Everybody can see that?
Yep.
Okay. So psychology in Israel in a few minutes. The process of licensing and specialization process.
Yechiel, put it on a full screen so they'll see it בצורת...
It is.
לא,
It
it's...
is. That's
No,
what
we
I
can
see.
see it. We see it like with everything on the side. There's like a
Well,
למטה.
I'm not. Somehow I'm. No, I know where it is. I don't see it like that. Now you see it?
Nope, now I don't see it.
Now we don't see it at all.
Okay. Fine. You can see
Yeah,
that?
it's fine like this. We can see, yeah.
Okay, I see it as a full screen somehow. I don't know why you can't see that, but okay. So licensing and specialization in Israel, these are the two stages or the two first stages of licensing. The first stage is to be licensing as a basic psychologist, and the second stage is to be licensed as a specialist psychologist in one of the six fields in Israel. There is clinical psychology, education psychology, medical psychology, which is health psychology, rehabilitative psychology, developmental or organizational and vocational psychology. And usually this stage takes place only after licensing as a basic psychologist. You see the next,
No. No.
okay.
No.
Okay, so the the process of basically the licensing of psychology is based on the psychologist law. And according to that law, in order to get a license as a psychologist, you have to have a master's degree and above in psychology from a university in Israel, or a master's degree and above in a psychology be recognized by the committee of licensing of psychologists. And after they decided it is equivalent to master's degree in Israel. And in order to what is equivalent degree area,
יחיאל, לא שומעים אותך טוב. יחיאל?
Abigail, are you able to
share? Yeah, do you want me to try and share or send you?
If you could take over, maybe because
yeah, I will. But can you make
Yeah.
me it able for me to share?
Yes, done.
Okay, so this is share. Do you see full screen or not full screen?
We see the slides on the side, but that's fine. I think that's okay.
You know, it's really now.
Yep.
Great. Okay. So let's go on. So you have, we talked about that, right? And
hello?
sorry, Yechiel, you
Yes.
want to go on? I put the matzeget on, so you want to go on? We couldn't hear you
Yes.
before. We couldn't
Oh,
hear
you
you.
couldn't hear it.
Yeah, so here, go on. Yechiel?
Oh, yes. So where was the point that I was talking to myself?
You were talking to yourself from here.
From here.
Yeah.
Okay.
So we can go on here.
Okay, so the psychologist law, psychologists, according to the psychologist law, in order to have a license as a psychologist, you have to have a master's degree from a university in Israel. That's the basic license. And if you have a degree from a university overseas, so the committee of licensing psychology have to recognize it as an equivalent to a master's degree in Israel. Next slide, please.
Do you see the next slide?
Abigail, you are sharing?
I did.
No, I don't.
The next slide, the equivalent degree? Yechiel, do you see it?
Nope.
No, I don't see that. No.
You do, Chaya?
No.
So maybe, okay.
Really? You don't see anything? No.
We still see
Just the slide
psychologist
of the
law.
psychologist law. So maybe we'll do it without
Yeah,
the
maybe we'll do it without.
presentation. But in that way, people can ask
Now, do you see
question.
anything?
Yeah, now we see equivalent.
So now, so
Yes,
we'll
the
do it
equivalent
like,
degree. Yes,
okay.
yes. So in our website, we have a document with the condition for recognizing a degree overseas as equivalent to a degree in Israel, and the conditions contains four conditions. The first one is a degree must be from a recognized institution, and most of the institutions in the States are fine with that condition. The second one is scope of studies. There have to be a certain amount of hours of courses in psychology in the first and the second degree or in the PsyD. And the duration of the studies have to be at least 4 years. And there is certain demands of the content of the studies in the first degree basic and in the basic studies, and since 2021 there is some demands for content in the higher degree, in the second degree. Maybe we'll pass through the specific condition. We won't get into these details, and if you'll have questions about them, we'll answer.
There is a good question. Somebody asked, does a counseling, like in America, there's a PsyD in counseling psychology. Is that an acceptable degree?
That's a good question. Avigal, you want to say something about that?
It depends. Since, as Yechiel said, there are four conditions, and the equivalency has specifics in each condition, we check and we go thoroughly through the studies. And in the United States, it's not all universities teach the same, not all degrees contain the same. It's like that all around, but we see lots of differences. So there might be degrees, especially the ones of PsyD and PhD with internship, that might be recognized, and there might be degrees, usually especially the ones of a lower, like the masters, that might not be. It depends on what the studies contain, if they're more counseling or more psychology. So I can't say, it's not for everybody the same, but
Yes. Usually, if the degree is a master degree, we can find if it's a master degree, usually it's not recognized by the APA, and you cannot get a psychology license in most of the states. And usually, well, I'm not sure usually, but um, we saw a lot of counseling psychology master degrees that the committee decided that it's more counseling and not psychology. But as Abigail said, we check every degree by its own components.
Thank you.
So okay, we can go back to the previous slide. So the process itself, basically, in order to get the basic psychology license, there is some process. There is some documents you have to send. Usually, um, confirmed documents of the studies, the diploma, in our website you can see all the documents that you have to bring. If you have a private practice, you also have to send a letter of good standing, and you can start the process before the Aliyah and send everything and get the actual license while you're getting your Teudat Zehut when you're coming here.
Say something about it. This is really, it's recommended, okay? I think it's very good to start the process as much before as you can before coming to Israel. When you start knowing that you want or you might want to come and make Aliyah, you can start the process, because once you hand everything early and we check it, and we try to check things now quite quickly if we can. If you hand in all the information and the documents we need, if something is missing, if something is needed, you can always do it in the United States, which is easier for you. It's easier for you in English. It's easier for you in the place you know, in the studies or the anything, the work that you know, and I think it might be easier. And then when you come to Israel, if everything's fine, you get approval from us, a conditioned approval, and then you can get the license, and usually both licenses, the first one and the second, then also the expertise license, quite fast. I think, because Melissa talked before, you came to Israel in August, and September and October you had your both license. So
I came to Israel in August and I got my license. My
September, the first one, and October, the second one, 3 weeks later.
November was the second one. So I got the first one in September, yeah, something like that. And then November was the mumchiyut. Because I did everything like you're recommending as much as I could in the States.
So then it's quite fast, and sometimes it's even faster. So I really, really recommend it. I think it's really good. I also want to say something about what you asked about counseling psychology, or any psychology studied abroad or in the United States for this matter. If you go onto a website, everything is really, really written with in details. So you can know, and you can read what is needed of you, what are the studies that are needed. And if you have any questions, you can write to us and we'll answer. So it will be easier to try to understand beforehand, and to try to be in touch with us beforehand.
I see if you're raising your hand or if you're submitting questions, anything that I know the answer to for sure clear, I'm just typing and sending the answer. Some questions I'm saving for the end when we're up to Q&A. Otherwise that's how I'm handling. So are we at the end of the presentation yet, or no, we're not. You want to keep going?
We're not, but maybe we can stop here and
I'll say something about the specialist license, just to say that it's a different committee. So after getting approved for your basic license, or getting the basic license, it depends if you're in Israel already or not. There's a different committee that checks your work, your internship, whatever you did as a psychologist abroad, and sees if it is also equivalent or almost equivalent to what is needed here for internship. They will also check work which was outside of your internship if something is missing. So we take, as a whole, we check all the experience to see if it can be approved as equivalent or almost equivalent to what is needed here. So this is mainly the thing, and then by that they decide if they can approve or if there is something needed. So I think this sums it up for now. I think we better stop and see maybe questions or questions later, whatever you want.
Yeah, so now we're going to move to our panel discussion. So I'm going to pose some more general questions, and each of the panelists is going to have an opportunity to answer. For people who are posting questions in the Q&A, some of the questions we're going to hold off on and we're going to answer later when we get to the Q&A portion of this. And some, if we know the answers, we're going to just type in and answer you as we go. And so I'm going to move to the more posed questions to panelists. You're welcome to answer as many or as few as you want, so you don't have to answer every single one. Okay, so we just went through more of the official process, and now we're going to talk more about what this actually looks like on the ground in real life in our experiences. being here. So for someone sitting here, different stages, different backgrounds, what are the different paths to building a career in Israel, and what do those paths involve? So you could briefly describe your path or what you're up to, or how you've applied working as a psychologist in Israel in a couple sentences.
I'm happy to go. I was in a program which I think it still exists through Misrat Aliyah, that is like a voucher program sort of thing, so that Misrat Aliyah would pay for the first year of a employment, on condition that an employer would then pay your salary for the second year. I don't know if I'm making myself clear. So in other words, like I went to an employer and I said, look, you'll get me 1 year free, on conditional that the second year you have to pay for me. And then thank God that worked out. And then I ended up staying there. That's the hospital where I'm working.
Thank you.
Okay, I could continue from there. Once again, it's a different perspective because I started here, and all my training and work experience were here. But from what I see, I think a lot of people coming here, if they start out part-time in the public sector, um, it's a good way to transition, both in terms of learning the language, making professional connections. If you're not carrying over a Zoom client base and you're trying to make connections here, so I think you need to have professional connections, which happens in the public sector. And then, besides for professional advancement, you also then can branch out to public practice. You have people who refer to you, versus just putting up a sign and said, I have a private practice here, and not having that flow if you have no name recognition in Israel. So I know a lot of Anglo psychologists that did that. They started in public and then went to private practice.
I'm happy to share my experience. It's very new. And also just, you guys will be new also when you move. So as I mentioned earlier, I started with a Zoom caseload, and I did have that in mind. I worked at cognitive and behavioral consultants beforehand and left about 6 months before I was making Aliyah, kind of having in mind that being able to bring a virtual caseload with me. So that's been really helpful. And also and also while I waited for my licensure to come through in Israel. So right now I've only been working privately, but it's even though my Israeli caseload is still low because I did only get licensed in November, it's kind of the Zoom caseload has from America has worked to kind of bridge that gap. And I'll also share that I've, been thinking a lot about how to gain more experience with people who have more experience practicing in Israel. So, toying with the idea of joining a larger group practice or doing something public. And also, I'm figuring out if my Hebrew is good enough right now to work with, to work in Hebrew. So, a little bit of, I'm a little bit unsure, and also that's what I've been doing so far.
I think I'll give a little bit of a different perspective. So when we decided we were going to make Aliyah, one of the things that was important to me was to, continue the income flow from the states, and so I intended to try to get licensed in actually other states to sort of branch out. And I started working in some different telehealth companies in the states. And so I worked for two different ones before I finally settled on this group practice I've been working on. Now, I know for myself in terms of like working privately, working on my own, that working on the business of things wasn't necessarily my strength, and so that's sort of why I gravitated more towards working in a group practice setting. And thank God it's been very helpful for me. Like I mentioned in the intro, it's been definitely challenging with the hours and working in the evening, such as prime bedtime. It's been challenging, but it's definitely doable. And again, if you sort of structure your schedule, about with having a family, it's definitely doable. But in my experience, again, working the continuing to work in the States while still trying to improve my Hebrew, as well as branch out and learn about the different areas and joining either there are professional organizations here in Israel that do cater to English speakers and English speaking clientele, which has been very helpful. So it's just sort of been my experience, but it's definitely been rewarding.
Thank you. I'll add just on my experience. I wasn't planning to talk about the panel, but I think I would just add as somebody who mostly built my practice, an American-based practice from here, although also ended up building an Israeli practice as well. If you I think in order to build a private practice in America from Israel, you need to be able to network with Americans. And so it's important to just, I think, factor in that you may have to spend time in hours that are not your regular, they're not normal hours, and go physically to America. So I think just like factor that in, that's kind of part of the game, I think, in working with American clients, in running a private practice in America from Israel, because you're not bumping into somebody on the street and then they're, sending, then they're recommending you to their neighbor. That's not happening because you're living here. And also to factor in that the finances look very, very different here. So, and we'll get to that later in the panel. Okay, let's talk a bit about licensure experience for those of us who have gone through the process of getting licensed over here, as somebody coming with a degree from America. What was that experience like for you? Where did you maybe get stuck or surprised? What can you do? What can somebody do before Aliyah to make this process easier?
I can jump in. I did this quite recently. My best piece of advice would be to go to MedX, like not so I guess it's typically in March, or at least in New Jersey it was in March. I went like the March bef 2 Marches before I made Aliyah. And I think that made the process really smooth for me because there are the two components, the Pinkas and then the Mumchiyut. So Medix really helped with the Pinkas, but then I think I got that. I went in March and I submitted all my paperwork, got the approval after the summer. I don't remember exactly when, but I remember thinking, oh, this wouldn't work so well if I made Aliyah this summer. And then once I got the approval, let's say shortly after that summer, I had the whole year then to work on the Pinkas, I'm sorry, the Mumchiyut paperwork, which was getting letters and etc. So that I think was really helpful. Um, and also, what was helpful for me was just being able to gather documents like earlier. Um, I like kept my syllabi from grad school and from college, knowing that I would need them one day to make Aliyah. So if you're past that point in your career, then it still just takes time to gather all that stuff. So I think there you can't be too early to gather syllabi. So that was also, I think, something that was really helpful for me, that when it came the time, I just was able to pull it all out of my Google folder.
I'll just jump on what Melissa said. MedX this year is going to be at the end of May 31st. It was scheduled for March 15th. As you know, we've had a little bit of rockets happening, but hopefully we will be in New Jersey May 31st. Yechiel or Avigal also join us at MedX. and you have an opportunity to not only speak to a representative from the Ministry of Health one-on-one, but also, as Melissa said, get your documents authenticated. The Ministry of Health needs to receive your documents in a very specific, authenticated way. And one of the options is to have your documents reviewed and processed with an Israeli notary who will be on site at Medix, New Jersey. If you want to speak to somebody from our team to decide whether or not it's worth the schlep from outside of the New York, New Jersey area, Chaya will be sending out our contact information in the follow-up email, as well as a link to Medix. I will just say that last year, people came to Medix from about 20 states and Canada. I wouldn't make the schlep if you're quite far away from making Aliyah, but if you're really within that year or two of making Aliyah, it could be worth it to come. You'll also get to speak to the hospitals and Kupot Cholim who are interested in hiring you. It's very much well worth the time.
Anybody else want to answer on this question? Okay, let's talk practically. How do psychologists make a living in Israel? What are realistic income paths? What's the role of Kupot versus private practice versus hybrid? Maybe if you're talking about the Kupot, maybe you can explain that, because I don't think that's so easy to understand before you lived here. Anything that surprised you financially? I'll say one thing on that. Sorry, I wasn't planning to talk on the panel, but I have so many things to say. I think it's really, 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 really important. It was really important for me to find an accountant who does both American and Israeli tax, who I can talk to a lot. I was working with somebody who's very well respected. A lot of people like them, and they should enjoy working with them. I did not find it easy because to work with them because they weren't so available to talk through the kinds of questions that I had. And I found working with an accountant who was really available to talk and brainstorm and think through things to be really, really, really helpful.
I'll definitely second that. It was really confusing, the tax situation. I'm still a little confused. And all that, but I think I'm going to be, and I think having a good, like, highly, but I don't know if you're saying you have an American accountant and an Israeli accountant.
No,
I
somebody
think,
who does both, specifically
okay.
somebody who does both, I think is really important.
Okay, so I just kept my American accountants and they have a
Yeah,
like
don't.
international counterpart. It sounds like your situation is easier than mine, and still just being able to like have an accountant to ask questions to who I know like or who I know at least since I have two are able to communicate with one another has been very helpful.
I could say a few words. I think that if we had this conversation even 6 months ago in terms of salary, it would be very different than what we're talking, where we're holding now. Because thank God, a very, very significant pay raise went into effect in the public sector for psychologists. Mordechai, when was that? I don't know, it was a couple of months ago.
The beginning of this year.
Yeah, so I can't, it was really at work people would say like starvation salary, but now it's not high tech, but it's more normative, and also if you can show that you had previous work experience, that also adds to your what they call like seniority level.
And also if you have PhD, it adds. Can you hear me?
Yep.
Okay, I'll say something about salary or in Israel. Shkalim is not dollars. Now it's good, but it's not always that way. And I think once somebody is used to live in the United States, in the way of life in the United States, it's quite challenging to move to Israel in many areas, not only work-wise. And as a psychologist, as you heard now, salaries are not very high. for us, they're okay, but they're not high. It's challenging. That's why most psychologists in Israel who can have private practice. But I think it's very, what can I say? It's interesting. I think it's a value to work in the public service, for me at least. Helping people here is something different maybe for us than working in services abroad. And the health system in Israel is very different than in the United States. Most of the health system is not private. It is public. So this is a very, very different situation. So once you work, even for a while in the public health service, you will understand better how it works here, what people need, what they seek, how to even have a better private practice, not only for Americans or English-speaking people, which is maybe easier in a private practice. So it's just to say that life here is very, very different from the United States, and also work. And it's very challenging. And I also want to say that this is also why we try to answer you and be of help throughout what you need if we can. It's not always something that we can do, not help you in everyday life, but at least answer your questions and try to be of help in this way.
Thank you so much for that.
Abigail, I appreciate your honesty about it. Definitely different. I would say from my experience, I always worked in the public sector, even as soon as I finished my internship. It definitely is a calling because you're treating very different socioeconomic community than, private practice. These are all people who cannot afford private practice, and you have to like relate to it that way. I would say like to make a living, either you have to supplement with private practice, two income household. Definitely cannot do it exclusively in public practice. That will not suffice. Just to mention the HMOs, because Chaya mentioned something about that could be a way also building your client base, because the way it works here that each HMO has their recognized list of psychologists. They refer to you, so you don't have to do any marketing or networking. But it has its limitations, meaning it's capped at a certain amount per session. You have to commit to a certain number of hours per week. So at a certain stage, it could be, for some people, it works for them, because it's more guaranteed income in a way with its limitations. But it definitely has its disadvantages, meaning you can't just sign up to work for an HMO and take one or two patients. They expect you to devote a significant part of the week to them.
Just
it's a good way to get known.
Sorry, I just wanted to explain that HMO is. Sorry, I just wanted to explain that an HMO is a kupa, and it's kind of like insurance in America, but it's way different. So that's what Mordechai said, Dr. Goffman is saying, is that that they put a lot more specific restrictions, and they're allowed to do things like that, which they wouldn't be allowed to do in America in the same way.
I just want to say a quick note for any U.S. citizens out there. And echo what Chaya Lieba said earlier, you should definitely, even before you make Aliyah, if you're a U.S. citizen, speak to a U.S. CPA in Israel. The United States, as many of you may know, is one of only 3 countries that taxes based on citizenship and not based on residency. And you have to speak to an accountant about this. It is not a reason not to work privately, but it is important that you know the ramifications of what that means before you go into it.
Right.
Yeah, I think, Chaya, you mentioned this before, but just to give an example, the U.S.-Israel tax treaty covers income. It does not cover Social Security. So you potentially could be paying both 15% Social Security in the States and Bituach Leumi here as well. which can then be exorbitant. But there are ways to work with that, becoming a corporation, for example. But you definitely, I got to a point where I also needed an accountant, one accountant who does both American and Israeli and is familiar with the intricacies of both, to best take care of my returns.
Allison, do you mind answering for us and if you notice any patterns of what helps people to succeed here financially as a psychologist?
Yeah, I think Abigail actually touched on this earlier. The people that I see who are the most successful, the most financially stable are those who diversify their income, those who have one foot in the public system and one foot privately. Maybe they're working with an organization even part-time. You don't just have to be a psychologist at a Kupat Cholim. There are many, many youth at risk, teens, villages, like there are many organizations and services that hire psychologists and also work privately or also work on Zoom with clients from the States. I think that having one foot in the Israeli society, the Israeli healthcare system also helps you integrate. I know many, many, many psychologists who continue their private practice, continue working with their clients from abroad, which I think is great financially and to continue that, psychologist-patient relationship on the one hand. On the other hand, I know people who only when they finally put that foot into the kupa, into the hospital system, into organizations, into community work, did they say, wow, I'm finally feeling like I'm contributing here, like I'm making connections, like I'm actually now figuring out how to navigate working as a psychologist in Hebrew. So I'd say the best advice that I see from where I'm sitting is to diversify the work that you're doing. Don't just back yourself into one corner. This is into a box. Oh, this is what I do.
If all right, I'd like to jump off of that and just share a thought. I think that there's a tension that many of us feel when we make Aliyah between integrating into Israel. We come here because we want to be here. There's different things that are drawing us to living here. But we also, our career is important to us. We've spent a lot of years training to become psychologists. We're passionate about the work that we do. And we also want to have a certain level of financial stability. And every person finds, that balance for them. I agree that for integrating, working in the public sector, I think hands down is going to help you get there the fastest. You're going to learn the language. Generally, the settings are very supportive, collegial, warm. There's lots of extra trainings that you get. I found that working in the school psychology department here in Beit Shemesh, and I hear very similar feedback from friends who are in other settings. But financially, it's tough. And I remember when my doctorate was recognized in the area that I worked at here in Beit Shemesh, I got a raise of a shekel and 30 agorot. And I just was like, what? Like this was what my doctorate was worth? A shekel raise. Now I know that that's different now. This legislation that Judith and Mordechai mentioned has passed and, salaries have gone up. But for a long time, there's been that tension. And that's why I just say, like, I understand the different paths that people take. I really do. From my own personal experience, I'm grateful for the years that I spent working in the public sector. I think that it really helped me professionally, language-wise, understanding the systems, really understanding the bureaucracy, definitely making professional connections with other people. I'm grateful that I continue to work a bit within more of a public sector work because I work at Tel Aviv University 1 day a week. So not only in private practice, but at the same time, I'll be honest, if I didn't move over to private practice, I would be a lot tighter financially. And that's with all of the tax load and everything. It's very difficult to only be, in the public sector. So unless it's drastically changed, Judith. So I don't know if since I've been there.
Drastically changed, but it's not enough.
Okay. Yeah, let's hope for more.
Okay.
Chaya, what are you doing at Tel Aviv? Are you in the counseling center?
No, I actually work in the medical school as a learning specialist. I work with medical students. I started off actually working in the New York program, which was the program in the medical school for international students, which is now closing. It's its last year, and I transferred to the regular, medical school track, 4-year and 6-year programs. And I work with students as essentially as a school psychologist, students who have ADHD or some learning differences, test anxiety, a lot of work with Miluimnikim who are both in Miluim and also trying to keep up with their studies. So actually very different than what I studied in the US, but absolutely like works with my training as a school and clinical psychologist. Yeah,
Okay.
and I enjoy it a lot.
That's super.
Yeah.
Okay, a lot of people are thinking about working with American clients from Israel. How viable is that? What do people realistically expect? Some questions I see coming in are things like, is insurance accepted? Do I have to be licensed in Israel before I can start doing that? Things like that. So if you could answer.
So I guess that's my area as the one that works mostly remotely. Um, so there are group practices that you can work in that the group practice accepts insurance. Insurance, Medicare. As far as seeing the client, as far as typically in those situations, like the practice knows that you're located in Israel. Um, Sometimes for clinical reasons or political reasons, maybe it's not always the best thing to sort of share where you are, as you can imagine. But that doesn't sort of negate the therapy that we do and so for example, like I keep a virtual background because I'm in my bomb shelter. That's where my office is. But as far as in terms of the insurance, there are group practices that do take insurance and yeah.
I want to say something about working from Israel with clients abroad, since you would have probably a dual license, right? You're
Yeah.
licensed in the United States and licensed in Israel as well. So you should find out with your insurance. You should be probably insured in the United States and also here for sure, because you're working as an American psychologist with your clients abroad. But you should find out about your Israeli insurance also, what it covers. So just being aware of the differences, of what things cover, and then with which maybe license, or what does it mean? Ask also a lawyer. I don't know to say everything, but I do think it's something that should be looked into. Mainly, this is and I also want to say something about the code of ethics, which is probably different in both countries, maybe not basically different, but there are probably things that are different. And you should also take time or find somebody to help you know the Israeli Code of Ethics after you become Israeli licensed. I hope we'll have some kind of a course going on about that so people can be helped, but we can also try to help you with that if you need any help.
Just to note, there is in terms of what Abigail was bringing up, in terms of malpractice insurance, you should speak with your malpractice insurance in both locations and find out what they're covering or whatever. And that's important to note. But I think the people were also asking about clients reimbursing for insurance in America, which is also a question. But I haven't seen. I do have clients who get reimbursed through their insurance, and the insurance company doesn't care where I am, they care where the client is, and then I report it as a telehealth session to help with that. Anything else that we want to talk about in terms of working with American clients from Israel?
Well, the one other thing that sort of reminded me also was, as you know, obviously you have to be licensed in the location where I think this was answered, but you have to be licensed in the location where the client is. So if your client's in New York, make sure you're licensed in New York. If they're in Florida, be licensed in Florida, etc. So make sure like we're saying, make sure your malpractice is covers, telehealth as well.
Excellent. And I think the other points we addressed in terms of working with American clients is either have to kind of come with a practice or expect to need to do additional networking or other connecting with Americans in some sort of way in order to build and maintain that. If that's your plan. Okay, for someone
Hi,
coming,
Lieba. One more thing I'll just mention,
yeah,
Neil, this is similar to one of the points that you made. Where it's not just working on off hours, it's also like the communication. So I have found since I'm working with people on an Israeli time zone and an American time zone, right, Chaya Lieba, similar to you, like I feel like I'm always like I wake up in the morning and I have to check my phone because of the messages that I got last night that were a normal time for Americans to send a message. So it just in terms of I think it wasn't so, like the hours and when I'm working was something I knew, but just when you're expected to be available, I think is another factor. And I assume like different people set different boundaries, right? Like some people might say, I'm on an Israeli time zone, I'm going to answer messages on an Israeli time zone. I work with Americans, so I'm going to answer more on an American time zone. But just something to keep in mind, like, especially Neil, you mentioned some of your patients don't actually know you're in Israel. That's also something to keep in mind. Like if they don't know you're there, like in my experience, I tell my patients that I am in Israel, but I understand either decision. But that is something to keep in mind. It's not just being available for sessions. It's also like part of our job is communication, collateral calls with other providers, responding to emails. If we do DBT, there's coaching calls. So additional stuff like that that you just don't necessarily anticipate.
one nice thing about DBT clients is that there tends to be an increase in need for coaching calls very late at night, which is morning here. So
Yes.
that kind of works, but it sometimes coincides with drop off time. So
Right.
not always. One other thing I was going to say about that is that personally, it took me a few years to decide this, but I ended up choosing to wake up very early. And sometimes people make fun of me for that, but that's what I found works well for me. So this is like already late for me. And then waking up early I found was a way that I could accommodate American clients, but also um force like an endpoint to my day, because otherwise I was just like
Yeah.
hard to cut off the end of the day. So I'll say that. Okay. So I see a lot of questions also coming in about Hebrew. If I'm not coming in with perfect Hebrew or without full licensure, how can I get started? What are my options? And if anybody wants to talk to that question, I'll just like open it by saying there are a lot of options if you don't speak Hebrew, but it certainly is going to limit you. You're not going to be able to work in a school setting without Hebrew. So that might limit your options. But yeah, take it away. If you want to jump in.
Personally, this is where I found working in a shapach, so in a shir tziburi setting, to be actually very helpful. So you are kind of throwing yourself in, which is a little bit like Ulpan, right? Like you're throwing yourself into Hebrew. Um, but overall, like such a warm, supportive, collegial environment. There are other people who've been there, they're also former Olim. I don't know if you ever lose that sense of being in Aleph fully. Um, and and so you're thrown in and there's people that are supporting you and you're trying your best. I think also to recall like this is a country of Olim, and if people themselves are not Olim, their grandparents were. There are not so many people who could claim that their, family has been here for 100 plus years. And so there is, I think, just a lot of understanding that you'll receive and just grace that you'll receive from clients and families and other people. And in that way, personally, I found that to be, it was a difficult beginning, it's going to be difficult. And I knew it was going to be, but I found overall to be a path that worked very well for me. So that would be my advice. If you can to do work in public sector, and hopefully, that will help you ease in.
I think we're the only profession that does not require by law Hebrew for getting license. Like physicians or doctors do need to show?
There are quite a few professions that don't require Hebrew for licensing, but definitely
Most
it's
do
important to be able
require
to
accounting.
work.
Doctors for sure need it for licensing, but we don't. And it's on one hand, it makes it easier to get a license maybe, but on the other hand, it makes it difficult afterwards because you need the language. So it goes both ways.
I
Yeah,
want to
no,
say, sorry.
sorry, I just Abigail is correct that there definitely are a lot of professions that require Hebrew for licensure. A lot of them don't. And psychology
I
is
mean mostly in the healthcare.
and psychology is one of them. I will just note that Misrata Klita organizes sometimes an Ulpan specifically geared towards psychologists and social workers. It's not something that they'll say in June that it's opening in September. It's something that you really need to advocate for yourself with your local Misrata Klita office. Psychologists making Aliyah are entitled to a regular Ulpan at their level, and then a medical Ulpan, either general medical Ulpan or this sometimes offered Ulpan for psychologists and social workers. Be your own advocate. Talk to Misrata Klita. Make sure that you're on their list for hopefully opening this course.
Yeah, I was going to say, so in my case, like, thank God I came with strong Hebrew. And then I also did that psychology opans. That was already like 9 years ago.
Okay, final question for the panel. Looking back, what would you want psychologists considering Aliyah to know early on?
I will maybe say something, taking what Batya said about people being wanting to be helpful and pro. And so I also want to say that we have a lot of good intentions. And I know sometimes people do not always feel that way, or challenges make it feel different. But I would like you to bear in mind that we all want, or at least we in the licensing and the psychology national department want to help you and want to make your aliyah as easiest or I don't know, smooth as possible. And so we are here to be for you, trying to be as flexible as we can, although we're under regulatory law, so we also have obligations and borders that we cannot break. But really, really feel free to write to us, to find ways to correspond with us. We're here for you.
Now, Miguel, on that, somebody wrote, is there somebody that a few people asked, is my case is specific, my case is different. Is there someone I can speak to? What's the best way to get in touch with you?
The best way is by email, the best way, because we're flooded and we're only two. So it's like, it seems, it's a department, but we have very few people working with us. But the best way is to write us an email. Also, we can't speak on phone with abroad, so it will not help. But email is the best. We'll answer again and again. And if there's something that needs more thorough help, we might do it also with the help of Nefesh B'Nefesh if we need to. I think email for a start is the best way.
And I'll send out your email address included in that email that we'll send out after this for all registrants. Anybody else want to answer? What would you want psychologists considering Aliyah to know early on?
Just to follow up on what Abigail said, Yes, so Abigail, I am one of those people who emailed you a lot last year. And I met you at I think the first medics I went to. Yechiel, I think I met you at the next medics I went to, and you were both extremely just so helpful and willing to answer questions. I think I had some questions that were like really silly and unnecessary, and like I'm so happy I asked because I got my answers, even if looking back they were silly questions. And on that note, also, I spoke to I think a million people, including Chaya Lieba, many, many times, just who have gone through the process also. And I mean, I can speak for myself and all the people who are willing to talk to me that if you just like want to talk to somebody who's recently gone through it, if you have like quick questions like that or not so quick questions like that, I found that people were so willing to talk to me. So both like formal people within the Ministry of Health, but also like people like me who recently went through the process and I just found that like I reached out to people I didn't know mostly, and everyone was so willing to help. So like don't hesitate to reach out because I think probably everybody got help from other people also.
Absolutely. And I want to just note on that. That's how this panel came to happen because after October 7th, I got flooded with questions from colleagues and down colleagues and about the process about living here as a psychologist. And there's just a lot of people who are willing to help and a lot of people with questions. So if you want to join our WhatsApp group or just want to reach out, there's people who want to help, but it is a confusing process or whatever. It's a process.
Yeah, I wanted to say a few words in terms of what people could know. I think something to know is that it's very, very gratifying. I find living in Israel and being a psychologist in Israel very, very gratifying. Israel is so much in the news, and we're you feel like you're living with the times. I don't know, with the history. Um, that's how I feel. Like it's in other words, it helps to feel connected to people. Helps you feel like you're kind of have your kind of. I'm sorry for not articulating myself better, but like feel like you're on the forefront of what's happening in the world, right? What's happening in the Jewish world, and I think it's very exciting.
Yeah, I would follow up on that. I very much agree, Judith, with what you said. I also work with Misrad Bitachon, so I've been treating soldiers who were in Be'eri on October 7th. I mean, that's not an experience you have working anywhere else. Very gratifying, and these are kids who are there, these soldiers, and it's very meaningful. And I think, like in terms of just most psychologists are not good with money, but I think in terms of income, you have to have a real reality check on what your expectations are. It's not it's not like, five-town rates, but it also very much depends on who your clientele are. Are you going to be treating exclusively gap year students who happen to be from Lawrence and therefore charge accordingly, more closer to the US rates, or are you treating Israelis with Israeli incomes and therefore cannot afford that? So part of deciding where you want to practice and who your client base will be, that's another question of, what your anticipated income will be, because different client populations can afford very different amounts of money. Besides for the ethical question of, what to charge. But I think it's something to keep in mind. It's really very wide range.
I understood there's a question about the exam or an exam. Am I right?
I want to wrap up our panel first, so let's and then I'm going to pose some of the questions that have been submitted that we haven't gotten to yet. So if anybody else wants to come back to the question of what would you want psychologists considering Aliyah to know early on? Okay, then I'll pop in with my I'm so just watching. I've been watching who's attending, and so many colleagues are here, and it really it makes me emotional. I really want everybody to be in Arts Israel. That's my bias, and to see so many colleagues just wanting to think about it, consider it when it's a complete change in how you probably envisioned your career. For me, I personally wanted to live in Israel before I even went to graduate school, and was constantly focused on how I would make that work, and it totally played out differently than I thought it would. And I learned a lot along the way, and so I think there's just a lot of support that's needed, and a lot of different configurations to make it happen. Um, and yeah, I'm just grateful that we're having this space. So I think let's move over to the questions that we haven't yet addressed. So I'm going to try to pose these, and any of the panelists are welcome to jump in. So one question I saw come up a couple times was any additional information regarding neuropsychology. I think Dr. Bronstein, you can answer.
Neuropsychology in Israel is under rehabilitation psychology. So whoever is a neuropsychologist in the United States should try to look into both specializations, clinical and rehabilitation, and see what is what suits them more, what is more like what they did or studied, and you could also apply for both and see what each committee tells you, because we have 6 committees, okay, 6 expertise committees. Each committee deals with one specialty, and you can apply for more than one committee. I sent you links, Chaya, so you can send people. You can apply to more than one committee and see then what you hear from each of them and see what suits you best, or what is faster for you also, what is easier, what you need less to do, or maybe not do anything, and you get your specialist license immediately. So this is also a way, because in Israel, after you get your license, there's much you can do under each specialty license. You can do whatever you know to do, really.
Abigail, I want to come back to that, but I want to first hear from Dr. Bronstein, if you don't mind speaking. And if you could
Hi,
also
sure.
answer speak to neuropsych evaluations and what that is like here.
Okay, so just a little bit in terms of my background, my training, like I mentioned in the beginning. So I have a PsyD in child clinical school psychology, and my postdoc was at the Child Mind Institute, where I worked for a research study that they're still running called the Healthy Brain Network, and I did neuropsych evaluations there. I was there for 2 years, and then I made Aliyah. In terms of neuropsych testing, so exactly like Avigail mentioned, neuropsychology here falls under the rubric of rehab, of shikumi psychology. So someone could get mumchiyot to become, psychologit shikumit, and then they could do a big, in my understanding, the breadth of testing adults, geriatric children, etc. There's also the world of child testing. That's really my own, background area. I always worked with children. And I ended up getting mumchiyat in 2 areas, in clinical and in school. And so right now, my private practice, I'm actually doing autism testing. So Ivchonei Tikshoret, which uses the ADAS and the ADIR and other measures, cognitive testing, of course, etc. I'm not doing broad neuropsychological evaluations here. I do have a colleague who, I believe when the colleague looked into getting mumchiyut as a shikumi psychologist at the time, there was a lot that was still required. I don't know if that's still the case. And so the colleague decided to apply for clinical mumchiyut, got clinical mumchiyut, and now does neuropsychological evaluations with the clinical mumchiyut license that the person has. And that's been, more than adequate for him. So one thing to remember is that, this is a different system. The system has its own logic. It's not the same logic that we had in the US in terms of different tchumim and other things, but that's the logic that's here. And it's important to know what the rules are specifically for the things that you want to do and see how you could, as Abigail said, obtain that. The only areas where I see where it makes a difference is in then some bureaucratic requirements, or for certain, let's say, services, someone who gets an evaluation or a diagnosis. In some situations, it needs to come from a certain professional. So it needs to either come from a licensed clinical psychologist or a licensed school psychologist or a licensed shikumi. So I really can't say for each individual case, you have to learn the laws here and see, in terms of your own area of testing, what you want to be doing and then see what works best for you here. I hope that that covers it in terms of testing. I mean, the whole conversation of testing in general, there's a lot to talk about in terms of the measures that we have here versus the measures in the US. That's a big conversation, evaluating bilingual kids. There's a lot, to talk about it. But you could do neuropsych testing definitely for children with a clinical license or school clinical. Yeah.
I
Any
wanted
other
to
questions, Nadia?
Yeah, there are more, but I
Yeah.
wanted to just add on that. I've spoken with Chaim Chesed about this. I highly recommend everybody reach out to them. They're just phenomenal. They're just
Yeah.
machines over there. One thing that they told me is that Dr. Bronstein is like amazing with getting Bituach Leumi, but it's tricky. It's tricky to do that. So over here, there's people want testing for testing, but everybody really wants testing also to qualify for things, which is a much more, think about it as like a much more socialized medicine model than we have in America. And so, yes, there is similar ideas in America, but over here, really, it does matter a lot. And so some people might want testing for testing's sakes, but most people are going to want that testing to be able to count. And so learning what Bituach Leumi wants in terms of that is also significant, and it's not just about mumchiyut, is my understanding.
I mean, I'll say, in terms of Bituach Leumi, I actually, I don't know anyone there. I just try very hard to provide like ethical, evidence-based work, based on their requirements. And I'm very candid with people who call me. I say my job is to like best understand your child and answer your questions, and I don't hand out diagnoses. So, people come and they may not get the diagnosis that they're hoping for, but I hope that they're getting the accurate diagnosis, that their child has. That's in terms of Bituach Leumi. Chaim Chesed is super helpful, like you said, in terms of like they know all these rules and can help guide you to the right professional for different evaluations. And it's one thing that I see that, I saw this also when I was working at the Shapach and I was sitting on Vadot Zakut Vifyun, so Vadot that help determine children's eligibility for special education services. We sit with our chart with, 15 different eligibility statuses, and for each status, what evaluation the child needs to get that status. So a child could get an anxiety disorder from a school psychologist, but that's not going to give them a certain eligibility status if they got the same diagnosis from a psychiatrist. So these are things that you learn when you work within the system. Like I said, there is a logic, but you have to work within the system to learn the logic and be able to help your clients.
I'm going to ask one more neuropsych question, but then I'm going to also pose, people are asking some like more specific questions. And I think, whether panelists are willing to give out private information for specific questions, or if those questions can be posed in our WhatsApp group and people who are in there can answer. So the last one I'll ask is how did you learn testing in Hebrew?
Okay, sorry, back to the Shapach. You keep plugging the Shapach here.
Or maybe just to explain that in a little more detail, what that means.
Yeah, so I worked as a school psychologist for 6.5 years. Now, part of here we really focused on getting, mumchiyut as a clinical psychologist. But like it was mentioned, there's 6 different areas of specialization. So as a school psychologist, I don't know if this is still the case because I made Aliyah 9 years ago, but at the time I was told that after submitting everything, I had to take 2 courses at Hebrew, which I did, and work for a year, and then I would get my license. Thank God I had a child within that time frame, so it got stretched out to 3 years. I had a baby, but in my time at the Shapach, I was able to learn the different tests that are here. Yeah, and that really helped me, as I said, learn the system, learn what's important to focus on in reports, and learn the lay of the land in terms of testing. Yeah.
So that's, I think, one of the really great reasons for working in the public sector is that you.
But I will say I have colleagues who have chosen not to do that, who've chosen to get their clinical license and essentially they work with American clients and thank God they're full, there is a clientele for the work that they're doing. So they're using American tests and measures.
Okay, I'm gonna move to other questions. But I did want to just to explain, like, for people who are having more specific questions for specific panelists, I think what we'll do is you're welcome to join that WhatsApp group and pose questions there, and people will answer there. And then if any of our panelists want to give out their information, that'll be included in that follow-up email. Okay, there were a few questions about getting mumchiyut in multiple tchumim. So a lot of people have school clinical degrees. Can they get mumchiyut in both school and clinical?
As Batya said, she got both.
I just answered that. Yeah.
Oh, it depends. Yeah, she has both, and it depends. Many Israelis have both, two or others, two specializations. It depends what you study. That's what I said. I think there are 6 committees for each committee for each specialization. I think some of you might want to apply to more than one committee anyways to see. First, you might want to have 2 specializations, but even if you don't, you might want to see which would be fastest, easiest, helpful more. As Batya said, you needed to take courses in educational psychology, or what you call school psychology in the United States, because it's a system and you work in a system, so you have to know the Israeli system. In clinical psychology, you have to know the Israeli, let's say, maybe the agnostic system, but you don't have to know or work or compulsory have to know the medical system in order to get your license, your specialization license. You might need, for some reason, to do 1 year maybe or 2. It depends what you did in the United States, but not for this sake. So it's good to apply to more than one committee if you think it's relevant to you. And you might get also 2 licenses. Yeah, sure.
Does that impact who you're able to see? Practically, what does that mean?
In Israel, but you can say more about that if she wants. Schools only, the things in schools that only school psychologists can do. Okay? There is a law for children for diagnosis children for the school system. This is what you meant by who can give
right. This is right.
It's not general. It's not just giving a diagnosis for somebody who comes, for instance, to Kupat Cholim, okay, or to the health system, but it is under the educational system that for some, it depends for which, but for some, you need to have only a special psychologist to make your diagnosis, or a psychiatrist. Also in autism and ADHD, that's under also the health ministry. You need to be diagnosed by a psychologist as well as a psychiatrist. So it depends. But these are things that if you go to the educational system, you learn. And if you don't, then you don't need to know that usually.
Yeah.
I would just add another. I'm sorry. I would just add another area of assessments is also psychodiagnostic assessments that clinical psychologists do. I get a steady referral of assessments from the Revacha, from the welfare department of the Iriyah, for kids who are from troubled backgrounds and are, going to be living in therapeutic dormitories. And by law, they have to have a psychodiagnostic assessment. So that's also getting back to your previous question. It's an additional source of income if you're looking to branch out, besides for private assessments that come your way as well. So.
Right.
I'm gonna answer one more of the questions that have been posted live, and then I'm gonna move to questions that were emailed into us previously. Somebody asked if they're planning to make Aliyah pre-American licensure. What are their options for their completing their licensure or not? How will that impact finding a job in Israel? I'd like to answer that because I've guided a lot of people with that issue. Essentially, you can't really work here, so you have to work there, which is not a problem. I mean, you should always contact your own board of education to find out the laws about this. But whenever I've checked this multiple times, the answer has been that it's fine to work under somebody who's licensed in, let's say, for example, New York, work with New York clients and a New York psych permit, um, and um, and then see those clients there, get your New York licensure that way. And you can do that virtually, just like anybody who's living in Israel, who's working with American clients. That's under the American licensure domain. So that's an option for handling that. I don't know of other solutions, but that's what I know of if you want to make Aliyah pre-American licensure. In terms of Israeli licensure, I think you would have to find a way to continue working. You wouldn't have enough hours to apply for Israeli licensure, pre-American licensure. So is my understanding. So you would have to find a way to work, which I think would probably involve starting like applying for Pinkas Psychologim and then doing internship here. I believe that's the answer to that. Okay, one of the questions pre-submitted. Can you walk us through what documentation is actually needed to transfer a degree or license to Israel? I mean, we addressed this, but maybe do we feel like we fully addressed that, or would it be helpful still to walk through it one more time, really breaking it down? I think I see, because I think I'm repeating that question because I'm seeing a lot of questions about an exam. Does it have to be in Hebrew? Can be in English? Do we need to take this exam? Yeah.
Usually, I'll start with the exam. Exam for psychologists is needed only for after internship in Israel. Okay, it's the end of the internship. You get an internship exam, and if you pass it, it's, let's say in the clinic. I'm a clinical psychologist, so I'll say about the clinical psychologist. The exam is in diagnostics. There's one part in diagnostics. It's no, it's an oral exam. I mean, you write something and you have to hand cases and stuff, but then you're orally tested and in front of a committee of three psychologists. And one part is diagnostics, and the other part, and it's divided and at the same day, but it's divided. And the other is about psychotherapy. And so this is only if you do internship, full or part internship in Israel. I'll say most people, most Americans, most people studying and coming from North America, especially the United States, that come with the PsyD, and after internship, most of them do not need internship here. They might need something, but not a full internship, and usually will not need an exam. And we usually try to be flexible with new immigrants, knowing that it's difficult to take an exam in Hebrew. The exam is in Hebrew. So sometimes you can do a year instead of an exam. There are many ways to help new immigrants. I'm trying to say that I do not remember, and I've been in the clinical committee for many years, for 8 years. I do not remember somebody who did internship in the United States and needed an exam of any sort here. I do remember people who didn't do internship at all, so they need internship, but after 4 years of internship in Israel, you'll be able to do the exam, to take the exam. But so I think whoever finished internship, was a psychologist in the United States, should not worry about that. This is about exam. You had another question about how we don't exchange licenses. Okay, it's a process. You'll get the links from Chaya. You can go and read. It's a process, like Batya said, each country with their laws. And it's very difficult, I think, it's challenging to go from one system to another, but it's not about exchanging the license. Like if I go to the United States and I'm an American, I cannot exchange my license. If I don't have a PsyD or a PhD, I cannot be a psychologist, no matter how many years I've been working. So it's easier when you come to Israel because you don't need a PsyD or a PhD. So even people with masters in the United States who could not have been psychologists and were only maybe counselors or whatever, or mental health counselors, might be able to be, or people who were school psychologists in the United States with an MA might be psychologists here, and will be able to do private practice. So it's different. Sometimes it's easier, sometimes it makes it more difficult. But we don't exchange license. We check studies and we check your professional background, working background.
So to tack on that, because there were a lot of questions about does being licensed matter? Does the EPPP count? Do they look at the EPPP? To all those questions, essentially, no. They're looking at your if you have a BTL for your bachelor's. No, they're looking at did you complete this coursework, and it's listed on the website. You can look at what coursework was completed, was it completed? And if not, you can do that post-bac or whatever has to be done. But that's what they're looking at. They're not looking, and they're also looking at years of working post-masters. That was another question that came up a lot. Amount of years working post-masters, which is why you probably want to do a postdoc just in terms of you need the amount of hours, not because you need the licensure. So just to clarify, you might want the licensure. I recommend it. It's good to have, but
you need the experience and the supervision. That's what you're checking.
Yeah.
But you can see everything on the web. So please, go on the web, and then if you have questions, ask us.
Another question that people asked frequently was, what should someone in graduate school be doing now if they're planning Aliyah? I will just briefly answer that, which is save all your syllabi from undergrad and graduate school. If you haven't started, start now. Start asking your friends, classmates, cohort members, and get letters. You need a letter of good standing. You need a letter from every work experience you have. So start collecting those letters.
Collect supervision hours that you took and what you were supervised on. Recommendation letters, that's for the second stage. Recommendation letters, you might also want it afterwards for working place, so just get anything you think might help you, and you can ask us, might help you on the way, because afterwards when you come here, you'll be fully booked with all things in Israel, and it will be much harder for you to even make yourself free for things like that, to think about it. It's not only getting it. So I think it's easier to do it when you're abroad and when you're still in the United States. For us, it's abroad, sorry, when you're still at home. Try to see on the web what you need. If you have any more questions, please write to ask us. We'll try to help you to see what you need. But also don't be anxious. If you don't have something, if you couldn't find something, if you studied many years ago and you can't get documents, which might be, don't get anxious. We'll help you. What you really need is your diplomas and your and your degree and your
transcript.
Yeah, and your transcripts. This you need. So you can usually in the United States you can ask the university you studied in to send you another one. So this you need. This is the most important thing: diplomas and transcripts.
I'm going to still run through a couple more of the questions that were pre-submitted that I think are important that I'm going to answer quickly, and then I'll go back to panel questions. So somebody asked what internship or postdoc options exist in Israel, especially for English speakers. So if you're trying to complete your American requirements, you can't, unless, like I said, you're working under an American psychologist, working for Americans virtually, if that's allowed by your board of education. So you have to check and clarify that. That's the only option. You can't work here. You'd have to basically work there from here. That's the explanation of that. And I'm all for that. Like I want people coming as soon as they can, and it's wise to complete your degree. It's wise to get everything done so that you can work here. So that's my thoughts.
Also to maybe say that whatever counts there will count for you to here too.
Yes.
Maybe not otherwise, but this way.
Okay, then there were a lot of questions about salary, realistic salary expectations. I think just we did address this. I think as a panel, we've addressed this, but I did want to make one more point on that, which is I think even in private practice, the rates are significantly different, and you're paying other fees, basically that or mom is huge. So those are some things to consider, that even in private practice, it is a massive difference from what people are charging in America. And just to understand that even private is not the same thing, and all your neighbors will be in the same boat, so you will figure it out together. That's a big adjustment, but something to deal with and to get creative about. I think the diversifying is really, really important. And I think public-private is one way to diversify, but there's also many other ways to diversify. Always willing to get creative. Okay, very similar questions that were also posted. People are always asking this, I'm just going to repeat, which is that you need to follow the licensure laws of where your client is. So if your client's in Texas, it doesn't matter if they're not licensed in New York, you have to follow the laws of Texas. And taxes, we addressed that. Time differences we talked about. Okay, I think we addressed everything in the pre-sent in questions. I'll go back to the live submitted questions. Okay, some of these are very, very specific, so we'll see if anybody has answers for these. Does anybody have experience with degrees from Germany? Bachelor's, master's, 6 years mandatory training to qualify as a psychodynamic therapist? I would assume you just have to.
I put it as an answer to a bunch of questions, and I think this question also, the email address for the psychology department of the Ministry of Health. And I know that you'll send it out in your follow-up email. I just want to say a kol hakavod and thank you to Abigail and Yechiel. They've totally overhauled the Ministry of Health website. It's very, very clear. They do answer the email. So especially if you have specific questions about your case, send them an email.
Amazing. So I'm gonna scan for some more general questions. Is it preferable to get a degree in Israel or the US? And is it possible for somebody from America to get into grad school in Israel? Anybody want to take that one? Maybe Dr. Goff.
I really don't know what to answer. What do you mean preferable? Depends what you want to do.
Yeah, I think I also
consider... if you want to work also in the United States, preferably for you to study in the United States, because I think I do think that because we're dealing or in Israel, we see Aliyah as value, and we really want people to come here. We try to make as much compromise and be flexible to help people get licensed here, even though if they were Israelis, they would not get it. Or they don't get it even today. But it's not the other way around. So if you study here and you should find out what it takes to be a psychologist in the United States if you want to work there, and you study here. I'm not sure. I don't know. I know that I can't be, but you might be able to be, but you have to find out ahead of time. So if you're also just started your studies in the United States, you can write to us saying, I'm studying this, I've done my bachelor's degree in this and this. Can I go on studying in Israel? Usually if you have a bachelor's degree with a major in psychology, it's like in Israel, we have our bachelor's degree is usually with a major. And you can probably be going on studying here in one of the universities. So I think it's a person, it's a specific question. It's not something to answer just like that. Depends what you want to do, where you want to do. If you want a
I'll give
PhD
it.
PsyD or
Yes,
not.
okay, no,
Well,
okay.
there's no PsyD yet, so
I'll give a little bit of a zoom out answer if you are at a crossroads and you have not yet started school and you're trying to decide whether or not to finish school wherever you are and then make Aliyah or make Aliyah now and then do school in Israel. So then I think it's a relevant question. If you do school in Israel, you're jumping into the system much earlier. Your Hebrew is going to be so much better. You're going to come out of school very ready to work here in Israel as a psychologist, on the one hand. On the other hand, not everybody can do higher education in Hebrew. Even if your Hebrew gets really, really, really good, it's a big challenge to do higher education in Israel in a language that's not your native tongue. I'll say that at Nefesh B'Nefesh, we have guidance staff for those looking into higher education in Israel and can try to help you make make a better educated decision about whether to do your studies before you make Aliyah or after you make Aliyah. They can discuss also financial aid options and stipends offered by the government to study in Israel if that's something that you're looking into, and they can also connect you to the government student authority to explore your options and programs.
I want to say that there is one English-speaking clinical psych master's program now that opened at Ariel University.
I did want to also say on this topic, I actually did consider this because I really wanted to live in Israel. And I worked in a lab in Hebrew University for a semester, and the students who I worked with were like, don't do it. So I think that does not mean you shouldn't do it. What that means is you should talk to people and decide for yourself. I know people who have done it, and I think it's rich and rewarding, and they get to be here and they get to be integrated and they got to study here. It's just different. So I think really learning about the system and really talking to people who have done it is really, really important to deciding, because it's a completely different process and experience for your training.
One point I would maybe add to that is that since I did my MA here as well, as I hear you have to learn two orientations. One of them is psychodynamic as a mandatory orientation that you have to learn. In addition to CBT, whether first wave, third wave, or family-oriented therapy. Whereas in the States, it's much more specified. Someone can go through the PsyD program without studying psychodynamic dynamic therapy on a deep level. So if you have an idea of where your love lies, here you must study that. That's the basis. And then in the States, it's very different. So that's another thing to consider.
There was one interesting question that I've been asked before that I didn't know the answer to. Is it required to work inpatient? I didn't think so, but I did, so I didn't know. To get licensed in Israel, do you have to have worked a year inpatient?
The answer is yes. You have to work a year, either hospital setting or what's it called? Ishpuz Yom. I'm not sure how to translate that into English.
Day
Hospital setting. A day hospital. You have to have a year of that. You can do more than a year, but you have to have a year of that to be exposed to more hardcore populations.
You need
When
at
I
least
was
a full
looking into
year in
things,
each setting. You need at least a full year in each setting. You can do more in each setting, but you need at least also in the ambulatory setting. You need at least the outpatient. You need also at least a year.
but is
But
this
we're
a
talking about
requirement now for
clinical.
Olim?
We're talking about
to do it?
clinical.
Didn't hear you.
Is this a requirement still for Olim that they've had to have a year in inpatient during their training?
In the internship in Israel, okay, for clinical psychologists, I'm talking only for clinical psychologists, so they're different in each sector is at least, it's 4 years part-time job or 2 years full-time job, at least 1 year in each setting, either outpatient or inpatient. Inpatient is, as Mordechai said, it's not only hospitals, okay? So inpatient is more, is a more flexible or wider setting than only hospitals or, okay? So that's why maybe Judith, you say no. But yes, it's needed. But as I said, we try to look at each person's experience flexibly as we can. And so it's really, it's checked specifically for each one. This is what I want to say. And also sometimes, not sometimes, whoever has more experience, we take the other experience into account as well and see what of it can be as equivalent to part of internship, maybe. So it's not only the internship that is taken into account. Okay.
I was going to ask one more. Oh, there was a few questions about is there a way to work when you come and you're not licensed, as volunteer or as internship?
I want to say something, which is maybe not so good and professional for me to say, but I will say. Whoever is not a psychologist in Israel can do almost what he wishes. There is no law for whoever is not it doesn't have a profession. There is a law for social workers, there's a law for psychologists, there's a law for health care, for occupational therapists and physical therapists, but whoever is not, there is no law, it's not like in the United States, that bounds them. So you cannot call yourself psychologist though, but you can do many things. You can call yourself psychotherapists.
Okay, so
but not psychologists. That's against the law.
I think that's very hard for psychologists, I've seen that's very hard for American psychologists to understand because we're so used to, I can't work until I'm licensed. So it's very hard to understand. But I do want to clarify that because there are a lot of other professionals without psychology degrees who have masters or certifications, not even masters, and working in this way. And so it's just important to understand the market. You're coming into a market of people who are much less trained than you, who are doing this kind of work. And so I think people come and
that's why people want the licensing, because it is like a trademark in Israel. And I want to say United States is very different from many, many, many countries. In Europe, there are also countries that psychologists are not licensed. So it's very different in the United States. They're very, as you say, everything is in place.
Yeah. So I think it's
almost.
Yeah. I think sometimes that also just on this this topic of, when you're thinking about moving yourself or your family here, and or your family here, I think you have to think about, don't be stuck that it has to look a particular way. It did not look at all like I thought it was going to look, and it worked out beautifully. And I'm sure everybody in the panel would echo that. And everyone's welcome to jump in with any final remarks. But I just want to say I'm so grateful for everybody who attended. It inspires me. Yeah, you're welcome to continue sending me messages with anything. The WhatsApp group is a really great place to post things because there are other people there who can chime in. It's a big group, so there's room to get some input and feedback there. And you'll get that follow-up email with some future with the email addresses, the links, and the upcoming events and all that information. And just thank you for attending, and thank you for considering living here, because we need you here.